The vertical chair climb. It's not an Olympic sport, but it does take effort, determination, and a nappy that flexes to fit. Pampers with its unique three-way fit adapts at the waist, legs, and bottom with up to 12 hours of dryness for all the freedom to play like a real champion. Get your limited edition fan design in stores now.
Pseudo-Cream is a triple action emollient which aids and assists in the management of excoriated skin. Pseudo-Cream provides a barrier protection to the skin from moisture and helps maintain the skin in a soft and supple condition as it soothes the irritated skin and helps promote healing. Pseudo-Cream's unique formulation contains no nut traces or steroids and is suitable for all ages, from infants through to elderly. Adult areas of use include dermatitis, including incontinence dermatitis, abrasions, including chafing under the breast, underarms, groin areas, eczema, and minor skin irritations. Pseudo-Cream can also be used around pressure areas to protect the good skin at wound site, as well as being used in conjunction with stoma appliances and/or other specialised wound products. Please refer to your healthcare professional. When applied in accordance with directions, Pseudo-Cream will not interfere with the absorption of incontinence pads or briefs and will not require additional products for removal. Active ingredients include anhydrous lanolin, zinc oxide, benzyl alcohol, benzyl benzoate, and benzyl cinnamate. A small amount goes a long way. Pseudo-Cream should be applied by placing a small amount on the finger and gently massaging into the skin until transparent. If the area stays white, you've applied too much, so start with a very small amount and you can always add more if needed. Remember, Pseudo-Cream is for topical use only. Do not apply Pseudo-Cream to open, wet wounds. And remember, always apply in the direction of hair growth, so to avoid build-up in the hair follicles. Pseudo-Cream is readily available in pharmacies and supermarkets in a variety of sizes. It also comes in a handy 30-gram tube, which can be found in the first aid medicinal aisle. The size range for hospital or facility use is 25 grams, 30 grams, 60, 125 and 250 grams, and can be obtained from our extensive distributor network, which includes home health distributors. Pseudo-Cream is a trusted and cost-effective way of addressing many excoriated skin issues for the elderly. Please read the label. Use only as directed, and if symptoms persist, consult your healthcare professional. For more information on Pseudo-Cream and our accredited ANF education program, healthcare professionals are invited to visit our website.
For your baby, breast milk is perfect. Nothing compares to it. It strengthens your baby's natural immune system and reduces the risk of infection. But how the months fly by. If you decide to move on from breastfeeding, Aptamil Follow-On from Milupa is the ideal choice. Like breast milk, it contains prebiotics, clinically proven to support baby's immune system, which helps protect from infections. Aptamil Follow-On with Immunofortis, supporting baby's immune system.
Feed their personalities. Cow and Gate.
Fever in children older than 3 months. Fever is one of the most common reasons children are brought to the emergency department. But fever is only a symptom, not an illness. Many minor illnesses such as ear infections, colds, the flu, and urinary infections may cause fever. Occasionally, fever is a symptom of a much more serious illness such as pneumonia, meningitis, or a blood infection. Whatever the cause, the important thing is how to treat a fever and recognize other symptoms that might require your child to be rechecked by a healthcare provider. What is fever? Fever is a body temperature greater than 100.4 degrees Fahrenheit or 38.0 degrees Celsius, but this will vary depending on how the temperature is taken. Fevers are generally harmless and may even help your child fight an infection. Taking a temperature. In general, you should always take your child's temperature if they appear ill or cranky. It is also a good idea to do so every 4 hours anytime your child is sick, because you may need to give medicine for the fever. Although your child may feel warm, you can only tell if they have a fever with a thermometer. There are many types of thermometers, but digital thermometers are the easiest to use. There are also several ways to take a temperature depending on your child's age. The ear method, underarm method, and forehead tape thermometer are not recommended as they are often inaccurate. Be sure to read the directions that come with your thermometer. Do not use mercury thermometers as they are unsafe. You can use the same type of thermometer for taking oral and rectal temperatures, but for sanitary reasons you should not use the same one for both. If using a digital thermometer, make sure you turn it on. If using a regular thermometer, make sure you shake it down to move the indicator fluid level below 92 degrees Fahrenheit or 33 degrees Celsius before you start. After each use, clean the thermometer with soap and cool water. Do not use hot water. You may wish to record the temperature on a piece of paper with the date and time for your healthcare provider. Taking a rectal temperature. Rectal temperatures should be used for children less than 3 years of age or any child not able to do the oral method. Put a small amount of lubricant, such as petroleum jelly, on the tip of the thermometer. Place your child belly down on your lap or on a stable surface. You may need help holding your child. Almost all children cry when taking a rectal temperature, but you are not hurting them. Insert the thermometer 1/2 to 1 inch into the anus and hold it in place for 1 to 2 minutes or until you hear a beep if using a digital thermometer. Remove the thermometer and check the reading. Taking an oral temperature. You may use the oral temperature method for children at least 3 years of age. Wait at least 5 minutes after eating or drinking before taking an oral temperature. Place the thermometer tip under the tongue toward the back side of the mouth. Hold in place for 1 to 2 minutes or until you hear a beep if using a digital thermometer. Remove the thermometer and check the reading. Treatment for fever. Treatment may not be necessary for fevers less than 101 degrees Fahrenheit or 38.3 degrees Celsius unless your child is uncomfortable or has had seizures with fevers in the past. Ask your healthcare provider for special instructions if fevers have caused seizure. A fever will often cause your child's heart and breathing to speed up, and they may appear warm, flushed, or perspire. These are normal body reactions to a fever. There is no need to stay in bed with a fever, but your child should not run around or overexert. Fever may be a symptom of a contagious disease like chickenpox, so keep your child away from others if possible. Your child should wait at least 24 hours with no fever before returning to school, or longer if other symptoms such as rash are present. No change in the diet is necessary, but children with fevers will often not feel like eating. Do not force solid foods, but be sure to encourage fluid intake to avoid dehydration. The types of fluid depend on your child's age and whether there is vomiting or diarrhea. Infants less than 6 months should be given an oral electrolyte solution, like Pedialyte. For other children, water, popsicles, diluted fruit juices, and flavored gelatin are usually best. Sport drinks, like Gatorade, may cause or prolong diarrhea, but may be okay in children older than 6 months as long as there is no diarrhea. Drinks containing caffeine, including colas and tea, should be avoided. Watch for these signs of dehydration in your child: no tears when crying, dry mouth and eyes, decrease in urinating. Infants should urinate more than 3 times in 24 hours, older children at least twice per day. Keep your child's room comfortably cool, well ventilated, and not stuffy or hot. Dress your child lightly in thin pajamas, shorts, underwear, or diapers. Cover your child only with a sheet or leave uncovered. Do not cover with a blanket until the fever is gone. Sponge bathing is no longer recommended for treatment of fever. Never use rubbing alcohol to cool a child with fever. Medications for fever. A fever by itself does not mean your child needs an antibiotic, but if one is prescribed, be sure to get it filled and give as directed. Fever medication may also be present in other over-the-counter treatments such as cold preparations. Be sure to read the medication label so that your child does not receive double doses of the same medicine. Contact your healthcare provider or pharmacist if you have any questions or are uncertain about the right formulation or dose to use. Acetaminophen is the best medication to treat fever and is given every 4 hours when needed. It comes by many brand names such as Tylenol, Tempra, and Panadol. There are also different formulations and concentrations including infant drops, liquid, chewable, tablet, and rectal suppository forms. How much is It is important to give the correct dose, so be sure you understand how much to give. If your healthcare provider did not give specific instructions, follow the directions on the medicine bottle label or call for instructions. Ibuprofen may also be used to treat fever in children 2 months or older. Because it is a different medication than acetaminophen, ibuprofen can be given along with acetaminophen when necessary. If used, ibuprofen is given every 6 hours and should not be used if your child is vomiting or dehydrated. Ibuprofen comes by many different brand names including Motrin and Advil. There are different formulations and concentrations including infant drops, liquid, chewable, and tablet forms. Like acetaminophen, it is important to give the correct dose. Because ibuprofen is a different medication than acetaminophen, the amount given may also be different. How much you will give will depend on which concentration used and your child's weight. Follow your healthcare provider's recommendations or the directions on the medicine bottle label. Aspirin is not recommended for use in children due to the possibility of Reye's syndrome. When to worry. Fevers, even high fevers, are not by themselves dangerous. It is more important to watch how your child is behaving after the fever comes down with medication. As long as your child is taking fluids, sleeping well, and has periods of playfulness, there should be no concern. When to call your healthcare provider. Most fevers can be treated at home, but because fevers are often a symptom of an infection, careful monitoring of your child's condition is important. Has a fever lasting 48 or more hours. Refuses fluids or is too ill to drink. Looks very ill. Is unusually drowsy or less alert. Is very fussy or cries and cannot be comforted even after the fever comes down. Return or go to an emergency department immediately if your child gets a new rash, especially dark purple spots, has difficulty breathing or excessive drooling, has a seizure, continues to get worse instead of getting better. Infants less than 3 months with a fever of 100.4 degrees Fahrenheit or 38.0 degrees Celsius or higher should be seen by a doctor immediately. What we have learned. You have a fever if your body temperature is greater than 100.4 degrees Fahrenheit. True or false? Answer, true. If your child has a fever, antibiotics are always necessary. True or false? Answer, false. A sign of dehydration in your child is no tears when crying. True or false? Answer, true.
Introducing the Summer Prenatal Listening System. With this system, what it allows you to do is listen to your baby's own heartbeat. It's very rarely that we can do that. It's normally only when we
The TD300 digital monitor uses DECT technology for guaranteed privacy, with useful features designed to give parents peace of mind. Let's take a look through its features. The digital technology is guaranteed interference-free with crystal clear sound and 100% privacy, so no one will be able to listen in. In optimum conditions, a maximum communication range of up to 350 metres is possible, allowing the parent unit to be carried around the house and garden for flexible portable monitoring. The parent unit is portable, allowing parents to continue with their day-to-day activities when baby is asleep. The sound level light display means parents can lower the volume of the parent unit while continuing to monitor baby. Parents can watch as the sound level light display reacts to the sound of the baby. The louder the sound, the more lights illuminate. The monitor features a warning signal that is activated when the batteries need replacing, or if the parent unit and baby unit are out of range of one another, giving the parent extra reassurance. The parent unit features a belt clip for hands-free convenience. Because we are so confident with the quality of our monitors, all include a 2-year guarantee. Full terms and conditions can be found on our website, tomy.co.uk. The sound activation mode is ideal for when your baby is that little older, when it's not necessary to hear every sound. For example, a cry rather than a gurgle. Offering the extra little reassurance and convenience, parents can talk to baby from afar using the two-way talkback feature. The remote-controlled nightlight means there's no need to disturb baby using the main light in the nursery. The temperature display allows you to monitor the ambient temperature in the nursery via the parent unit. The pager feature helps locate the parent unit in the event of it being misplaced. The parent unit offers easy recharging, so there's no hassle with batteries.
Introducing the Motorola Digital Audio Baby Monitor. It's the MBP8. Now, these monitors are a plug-in monitor, so there's no leads coming off whatsoever. I'm going to demonstrate to you how it all works as well. Now, obviously, we do have the parent and baby unit. Now, on the parent unit, there is a 300 metre range on there, so it is a very large range. It does go down to 50 metres indoors because we do have to allow for the thickness of walls, etc. So, on the actual parent unit itself here, we have the on-off button, which is down the centre here. We also have volume control, which is the minus and the plus. So you can have that as loud or as softly as need be. Onto the baby unit itself, we do have the on-off button. Now that's that little symbol down the bottom there. And another nice feature about this baby unit, it does have a night light. Now that glows along the top here. Okay, so they do fit into your plug socket at home. Now, I want to demonstrate this to you today. Now, I have an extension lead here to demonstrate how they work. Obviously, you're going to have your wall sockets at home. Now, the baby unit itself can't be any more than 1 metre away from the child's cot or Moses basket. So, plug in both units into my extension lead. Now, as you plug them in, they are automatically turned on. So, as you can see, that's now on with the green light. Now, the way this one works, your parent unit, it will flash until it picks up the nursery unit. And there we go, that's on. Now, as you can see, as I'm talking, the lights across here will flash. Now, obviously, that would be your baby crying. So as it goes into red, the baby's really crying. So you best go up and see what all the fuss is about. Now, to turn off, you literally push down this button and it automatically turns itself off. There, the green light has gone. So, as I say, the baby unit itself does have that night light, which is the glow just above here. Down here we have the light bulb symbol, so just by pushing that down once, as you can see, it gives off the glow at the top. Now, if you don't need that night light, just by pushing it again, it then fades away. So there we have the system. Like I say, it's got a good range on it, that 300 metre range. It is plugged in, so you can take it if you're going out and about to grandma or granddad's. The Motorola Baby Monitor.